Hi, welcome to the ProBalance PT podcast. My name is Ada Wells, and I am the owner and founder of ProBalance. I'm a physical therapist and certified Pilates teacher. The focus of this video is to give information to people who may have low bone density. If you don't know if you have low bone density, just kind of a simple little statistic here, approximately 50% of women over the age of 50 and approximately 25% of men over the age of 50 have low bone density. So an important thing to check on with your doctor to get a scan, particularly if you may have a family history. There's some correlation with if you have, say, smoked in the past, taken certain medications in the past, or it just is. So something that's very important to know when you do enter, when you are doing certain exercises. Now, Pilates is fabulous for people that have low bone density, and the reason why is that it really works to facilitate and to optimize posture and alignment and really learning how to move well with the least amount of forces, destructive forces to your spine. Now, in doing so, in classical Pilates, there are a certain number of exercises that are in positions that are contraindicated, meaning we do not want to perform them if you have low bone density. And I'm going to sort of go over what those positions are, and then I'll show you where you might see them in a Pilates class. So once again, whether you're here taking a class or you are at a facility or a studio, on the other side of the country, at least you're armed with some information. And if you do have low bone density, it's always great to work with somebody one-on-one first if you never have done Pilates before, so that they are aware of what you need and that you're aware of your modifications. If you tell the teacher that you have low bone density and they look at you with glazed eyes, you may want to make sure that you find somebody who is comfortable working with somebody with low bone density. Okay, so let's quickly go through the motions that we want to avoid, okay? So first one is spine flexion. And what spinal flexion is, and particularly flexion of the thoracic or the middle part of the back. If I have this dowel and I place it on my back, and I can basically touch the back of my head, the middle of my back, and kind of the sacrum or kind of the tailbone area here. If I go ahead and I hinge forward, notice how my spinal curves did not change. They stayed the same. That's great. I'm flexing from the hips. Hip flexion, okay. All right? This is great. This is how we should lift things, okay? So the people that do injure their backs and such, being able to have good spine mechanics and being able to have good mobility through the hips is important to be able to do this type of motion, this hinging from the hips. So this is fine. This is fine. My spinal curves have not changed. Now, spine flexion, you're going to see an increase of that spinal curve as I come forward. So notice how now as I'm coming off of the stick, my spine is forward. That position you want to absolutely avoid, okay? Spine flexion with low bone density can increase your chances of spinal compression fractures, and that's not what you want, because once you get one of those, your chances of getting an additional spinal compression fracture increase. They start increasing exponentially as you get them. So you do not want to have that happen, because that leads to disability and really bad problems down the line. Okay, so spinal flexion we want to avoid, but there's another motion called spinal extension, which is going back the opposite direction. Now, it's not just leaning my head back, but it's actually that you can see my upper spine kind of reversing its curve. That position is actually great for those who have low bone density. It's actually been shown that when people do exercises that promote extension of the spine, their chances of spinal compression fractures decrease. So anywhere where your spine is either neutral or an extension is going to be fabulous. We're going to want that. But if it goes into that forward position, it's absolutely contraindicated, okay? Now, there's a couple other motions that might be just ones to just have some caution with. One is rotation. So rotation is sort of spinning around an axis. Now, if you're rotating your spine and you're not necessarily going and cranking into its end range, and you're thinking about creating length through your body first, that's okay, all right? But if you are just kind of being really wound up and someone's giving you an extra push into that rotation, that may not necessarily be very healthy for your bones. So I would just say with your rotations, particularly end range rotation, be very, very, very careful, okay? Secondly is something called spine side bending, okay? So a side bend would be going in this direction, so kind of like you're doing a side stretch. Now, if you are doing that and you're really cranking over to one side, that puts a lot of compression on the vertebral bodies on this side, so that could create a compression fracture there. But if you think about creating length, and not so much bending over to the side, but bending over, say, to the top, the corner of the ceiling, what we're doing is we're creating that length with that movement, and that's going to be a little bit safer position for you to be able to do that side bending motion with. So just in summary, avoid flexion, particularly avoid flexion rotation. Those two combined motions are the absolute worst for low bone density. But you want to facilitate neutral, upright position, and even extension is going to be good within your exercise program. Okay, so let's talk a little bit about, this is a reformer, and these are Lego reformers in our studio. You might have different types of reformers depending on where you practice your Pilates. And you want to just be aware of how to get on and off of these so that you do protect your bones. So ideally, whether you have low bone density or even a back injury, if you scoot your rear end kind of all the way to the edge, place your hand down, and you're going to just teeter-totter your spine just to the side, and then you're in, okay? To get up, you want to do exactly the opposite. You rotate to your side, and then you come on up into just sort of that straight spine position, okay? That's how you do want to get on. I'm going to show you how you do not want to get on right here, okay? You do not want to get on where you come up and you roll back. So now my spine is in that flex position. Not good for the spine if you have low bone density. All right. Second thing is adjusting the foot bar. You want to be careful, particularly if you happen to have shorter arms. I have really long arms, so mine go here very easily. But you don't want to get in this position where you're rotating forward and you're adjusting from here. Notice I'm in flexion rotation, the absolute worst position for the spine. So I want to either, bring myself around and adjust that bar from here, or if I were standing, same thing, I'm going to hinge. Notice my spinal curves are not changing, and I can do my movement from there. You can also change sort of the position of that foot bar forward or back, and that's more, sometimes your teacher can do that for you, so just something to keep in mind. Okay, so then I'm going to show you a few exercises that are common exercises in the Pilates environment in a class. I'm going to stick to ones that you might find in a more basic class. There's a lot of more complex and advanced exercises that you would find, but for the purposes of this video, we're going to stay just very basic, okay? The first thing might be if you are doing an exercise where there's something that's called rowing series or maybe the roll downs, okay? That's already telling you that there's some rolling going on that may not necessarily be in your best interest. So you want to first, if they have an exercise where the rest of the class, I'm going to just give an example of rowing. They're starting with peeling their spine down, and notice how I'm in this forward position. I'm in flexion. You do not want to do that, okay? If they have the rest of the class doing that, you might lengthen your spine just a touch, and basically my carriage has come forward like about a ½ inch, okay? And now you can do a hinge back, okay? So hinges are no problem whether you're here or whether they do a roll down series. If the person's doing a roll down series there, this is spine flexion. You don't want to be there. But you can just do that little small, moving that carriage just a ½ inch or so forward, and then do your hinge, okay? That is going to be appropriate. And then from there, you can do whatever choreography you might end up finding in that exercise routine, okay? So those are ones to watch. It also, in a basic class, there may be some exercises where you're lying on your back. And just quickly, if you're on your back, and say you already do have a little bit of this forward kind of thoracic kyphosis here, and your head's like this, if you're lying on your back and you don't put a little something underneath your head, you may find that your head is in this really extended position. It's going to be really uncomfortable for your neck. It's going to be very hard for you to access your abdominal muscles. So you may need to have a little small pillow underneath your head. Once again, something to discuss with the teacher when you're there. Okay, so I'm going to go back down into lying down. And another common exercise that you might see in a basic class is a supine abdominal series. So here they may have your hands are in the straps, the legs are up, and they may start with some very nice work with just the arms, all right? But then they may have everybody try to curl up into this roll-up position. Now the problem with this roll-up position is I'm now in spine flexion, okay? So you are going to keep your head down And it might be that they're doing hundreds where you're pumping the arms, and the legs can be outstretched. That's fine. Note that this is not necessarily easier. It is a modification, but it is more difficult. So this is where if you need to have a little bit of padding under your head to make sure that you can access the abdominals, that's fine, so long as you're not cranked into flexion. It's just, you're just going to use that padding to support your posture. Okay? Another exercise that is where you're lying down might be bridging. And bridging on the reformer is just, well, let me go back. Bridging generally is not going to be an exercise that you have to worry as much about. The reformer does place you in a little bit different position than if you do this on the floor. What I usually recommend is that instead of doing a full bridge where you're going all the way up and all your forces are right here in the middle of your back, you may actually just peel up just about halfway. And from there, you can do whatever motions that you're going to do. I have this a little light here, so I'm working my hamstrings. So that is going to be okay for you. All right, you can do that little bit there. But I wouldn't come all the way on the reformer bridge all the way up to your shoulders. I just feel like that's a lot of pressure that's coming down on you. And that's something you can discuss with your teacher as well, whether, like I said, depending on the configuration of the reformer and where you are with regard to your bone density. I just feel it's a lot of pressure down, and you are in a little bit of flexion in the spine. On the mat, you're in a little different configuration. So it's usually, you can go up pretty much all the way there doing a bridge, and it's not going to matter so much. But on the reformer, we do want to watch that. Okay, last exercise I'm going to just talk about here, actually two more, is the Mermaid. And the Mermaid brings us to our hips. Now, there's some people that if they try to put their hips into this, or their legs into this Z-sit position, are so tight that they're basically, they're sitting here like this at the start of the exercise. Now, a good Pilates teacher isn't going to let them do that regardless of whether if they have low bone density or not. They're going to, put their legs back down and give them a modification so that they're not cranking over in that side bend. But you can see how that side bend position, we talked about not wanting to be way over into that big side bend with compression, could be a problem. Now, if a person has really easy movement in their hips and they can easily sit up, this is a non-issue, okay? If a person also, going back to that person who's really struggling here and they're cranking, this also happens to put a huge amount of rotational, sort of torsional force on the femoral head. So somebody who has fragile bones, this may not necessarily be the smartest position to sit in if they're very, very tight, because now we're taking everything, we've wound up the ligaments, and they're in a precarious position. So for a person that has very tight hips with low bone density, just keep their feet down, okay? I'm going to put my feet back up as though I have loose hips, low bone density. Okay, so then we talked a little bit about the side bending. So in a Mermaid, so long as you think about that sort of lengthening, and I think about reaching towards the upper corner of the wall, this is going to be a great position for me. Okay, I can move in and out of this, and my bones should be fairly safe. If I'm kind of crunching way over and really creating a lot of compression on the side, and once again, this isn't going to be great for anybody, but particularly with low bone density, that's not going to be so good, all right? There's a great variation for people who have healthy bones that includes a rotation, but it will not be good for somebody with low bone density. And that's going to look something like, person comes up, the teacher cues them to roll forward, and now look, I am in that flexion rotation. That's horrible. We don't want to be there if you have low bone density. So your modification might be to allow that top hip to lift, and you're just pivoting around. So we are almost more in an extension rotation, which is okay, but we're really not going to do too much here, okay? It's going to be a little bit of forward and back, but we're not going down and we're not going into this flex position, okay? You're just going to allow that rear end to come up, and you can just gently sort of move back and forth. Your gaze is going to come up and down a little bit, but your spine's not going to move, and then she gets everybody out of that, and you're in your good position, okay? The last exercise I want to talk about is some of the hip stretch series. And it's just because where you may have your spine when you're standing and you may not be aware of it. I'm going to stand on this side so you can see me because I'm tall. So when you're getting your feet and you're getting your body sort of situated here to do something like a scooter, notice how my spine has stayed neutral. Now there's variations of this where a person might go into flexion Or sometimes when people are just trying to get themselves all sort of situated, you see them, they're looking at their feet. And once again, I'm going into the spinal flex position. So just make sure you're keeping your spinal curves in that upright, neutral position while you're doing various movements. That's going to keep your spine safe and make it so that Pilates does become a very positive experience for you. Once again, this is just a little small example, but discuss your bone density with your teacher, particularly if they've never seen you before, and just make sure that you're safe when you are performing your exercises. Okay, until next time.